team here at NACHW. And we've been doing this work for a long time, and we're really excited to continue to engage with folks as well. So in today's agenda, Denise will be joining us at some point, and I'm sure she Denise being our leader, really kind of brings that energy, brings that enthusiasm that we always look forward to, and really is the driver on a lot of this work. So we'll be hearing from Denise at some point when she is able to join us. You recently met the co-chairs of our policy committee, who have been helping us lead and convening a lot of the thought partnership that we do with the board of directors and with our members. So again, thank you to our co-chairs for joining us and for helping us lead in this work. Today, we're going to be revisiting some highlights from our second annual Capitol Hill visit. And we have some amazing speakers, some participants that, really were highlighted during that experience. We have representation from Massachusetts, Rhode Island, and Oregon. And then we're going to get into some of our national CHW policy updates, a lot of the work that we've been doing in partnership with the folks over in Partners in Health. We're going to make a couple announcements on how some of our working groups are developing and some opportunities that folks here on the call might be interested in. And then we are going to talk a little bit about our second annual National CHW Awareness Week. So we all know how excited I get about that campaign. So I think it would be a really great note to help wrap us up. And we have allowed for about 30 minutes at the end of the call for folks that can stay on a little longer, that have questions. We want to make sure that we're able to get some of those questions answered for folks. So we're gearing up to have a great policy call. We're really looking for, in terms of what you're going to get out of participating in this call, is really being able to understand at least two of the policy developments that really impact the CHW workforce. We want folks to really be familiar with the opportunities that NACHW has. We know sometimes that even just by sending emails out or our newsletter, we want to continue to be intentional about making sure that folks know what opportunities they have with NACHW to participate in policy and advocacy, and how that can support your local efforts as well. And it's always really important to hear directly from CHWs about their experience in policy and advocacy, ways that we can improve, and just kind of hear of all of the strides that they're also doing at the local level as well. And as always, for folks, if anybody's joining us for the first time, we always want to center these calls around our mission, which is to unify CHWs across geography, ethnicity, sector, and experience to support communities that can achieve health equity and social justice. And in that same vein, NACHW continues to be committed to our values, which are to engage CHW allies, supporters, partners, sponsors, and influencers. We want to make sure we're constantly educating our stakeholders on the impact of CHWs. We want to make sure we expand membership, recognition opportunities, and collective action. We want to establish national voice and sustainable strategies on issues related to the CHW workforce. We also want to enhance our CHW leadership skills and opportunities for not only our members, for all the CHWs in the workforce. All right, so we're going to get into our second annual Capitol Hill visit and give you guys an overview of just how exciting this opportunity was. I always like to emphasize on like the second annual part because it really does speak to the momentum that we've had in the last year. It really speaks how the first year we really got together and we partnered with a lot of different organizations, and it was more of a call to action. This year was very focused on our members, very focused on the engagement and the participation, and the emerging CHW leadership that really has come out of all of these efforts. And we really were really pleased to say that we were able to accomplish that during this visit. And you'll hear a little bit more about the participants directly in terms of what their experience was and how it has enhanced their local leadership as well. All right, so our first CHW participant is Joanna Goncalves from New Bedford, Massachusetts. Joanna, I will ask you to come off mute and we will get into Well, sorry, before we go to Joanna, I just some highlights that I wanted to make sure that folks really understood, and this is kind of where I do my happy dance. So the CHW Access Act that you'll hear a little bit more about later when Angie gives some national policy updates was actually introduced on March 7th. So just on a couple of days before we headed to the Hill, which really gave us, the motivation that we needed to be able to meet with legislators and actually present something that was timely and that we've been working on for a long time. And we were able to get it introduced just in time ahead of the visit. We had 78 CHW and ally NACHW members who traveled to DC for the event, so all in person. NACHW members participated in about 117 meetings with lawmakers or their staffers. And this is all in one day, guys. This wasn't a series of days. We packed it in. We attended 100% of the meetings. We were present. We were able to meet with 30 state legislative offices, 57 unique House districts, 60 unique Senate districts. And, we can say it was such a warm welcome. We were welcome, we were engaged, and we were treated really great. And I think it was a great moment for all of us to be there and have that experience and experience it all on a one day. So thank you to all of the participants. I know many of you are on this call today. Thank you for your dedication. Thank you for showing up. I think we really were able to make an impact during that time, and I'm really looking forward to continuing to hear about all of the follow-up that has come from that visit. All right. And, just giving also another quick shout out to the folks that were on the panel for the second annual congressional briefing. I mean, these folks were pretty amazing. We had Honey Estrada from North Carolina, who, she always brings it, right? She always brings that energy. And it was great to see her shining on the panel alongside Shantany Jackson from Virginia, Irish Morano from New Mexico, and we had our incredible partner, a CEO of Partners in Health, Katie Bolbeck, who has always just been such a great ally and has really supported. Her and her staff have really supported so much of this effort. So, not only did we meet with legislators, but we also provided an additional opportunity for folks to really understand the workforce, what we have done, how far we've become, and how they can continue to support and be educated on the impact that CHWs have in the communities that they represent. So really want to underscore how powerful that panel was during that briefing at the Capitol Hill visit, and really looking forward to bring more of that type of discussion and overviews in the future as well. So thank you all that participated. All right, Joanna. Now I'm gonna turn it over to Joanna. Joanna, please, if you can kindly come off mute and walk us through some of these, some of your experience, but also these great pictures that we have here before us.
Of course. Hi, everybody. Hello. My name is Joanna Gonçalves. I am a community health worker from the heart, not made. And this was an incredible experience. I remember when I was on the call, when I received the email, I was asking myself, do I go? Like, what do I have to offer? Who am I, right? And then I talked to my director, my boss, and she goes, you're going to talk about your work. Who else better than you to talk about what you do? But still, it was that little nervous thing growing inside of me. And then when we went there, NACHW did a great work. We had the calls, and then we had a training where they pass all the information and stuff like that. But I was still very nervous because I didn't know. It was my first time. I didn't know what I was going to do there. Somebody told me, Kathy from Christine, I'm sorry, from PIH, Tanya, just relax. Just talk about what you do. And that's what we did. We just talked about what we do, what we are, and what we do. When we got to the meetings, we had 6 meetings. Our first meeting, the funny thing is, I wasn't expecting them to already know what community health workers were. Like they know, but community health workers for them, for majority of the people that we interacted, was somebody that helps the doctor, right? It's just somebody that works in the clinical settings. I don't work for a clinic, I don't work for a hospital, but I am a community health worker and I do community health worker's job. So I just went through what I do, why I do it, and why I figure that I needed to become what I am today to serve the community I serve. And I remember in one of the visits for Rep Kirim, he asked me, we met with Ryan. I was saying like, I am this, I'm this, and this, and this, and that. And then I'm like, I'm a car seat technician. And you look at me, car seat technician, community health worker. How? Why? How does that align? I'm like, just because my community needs it. It's a need that me as a community health worker I can serve. Why not? And then from there, I learned to make the connections, right? Listen, if you have a community health worker, this is me with my 12 certificates. This is only me. Imagine if you have 3 community health workers in your department, 3 community health workers in your local board of health doing everything that I'm doing. How many people do we reach? Not only people that needs the connection to the health providers, but people that needs connection to the city, period. And so they were it's just a meeting, like it was just a meeting. People were very open to us, to listen to us, to understand why we were there, the concerns that we had. When I went to the Elizabeth Warden's office, we met with, I have her name here, I'm not really good with names, Jessica Wong. And it's a name that stuck with me because she knew exactly when I said, I am from New Bedford, she knew the community that I serve. She knew the struggles that we go through. She asked questions specific to my communities, which means that people over there, they're looking, like they know who we are, they know what we're doing. And she asked like about the community health workers, the work that we do. We do what we did during COVID, because here in New Bedford, we had a group of community health workers, um, just volunteers, community health workers that decided to go out and help people, you know, and that got to them. So it was nothing crazy. And so this picture, it was me, Christine from PIH, and Terry, she's a community health worker alive. In here we have Ryan from the Kittens office. That's me, PIH, forgot his name right here. It was just, like I said, there's nothing crazy. It's just we go, we tell them what we do, why we do it, and they ask us questions. And then we say, you know what, the reason we're here is because today, this is what we brought. We need to make sure that our work is recognized, that how would we help more people if we get the reimbursed by Medicaid and Medicare, and explain why that is important for the people that you serve. From your, it could be your cousin down the street, it could be somebody that you don't know, but how the work that we do gets to everybody because people know us, people trust us. And I think I'm gonna be here, guys, ask me questions because I can talk all afternoon.
Thank you so much, Joanna. It's really a pleasure, really, to hear you speaking about your experience. I really, really consider you as an emerging leader in this advocacy and policy space. I mean, every time you talk for your community, you talk about the work, the passion is just so relatable. So thank you so much for participating and for your dedication and your engagement. And I really look forward to continue to work with you and seeing the amazing work that's coming out of New Bedford, Massachusetts. So thank you
Always
so,
here.
yes, awesome. All right, and now we are going to go a little bit down south to Rhode Island, where we have Corin Kabuchi, who was the first time that she was engaging with NACHW and also participating in these efforts, and has a real amazing story about how she made her way to the Capitol Hill, how everything kind of transpired after and how she continues to be very much engaged. I'm always getting text messages from her and updates, which are amazing to hear. But I will turn it over to you, Corin, to talk a little bit about your experience in the Hill and all of the amazing strides that have happened since.
Well, good afternoon, everyone. Can you hear me?
Yes.
Everyone well? Okay. Wow, I keep reliving this like dream-like event that was the trip to the Capitol, and joining everyone at NACHW, especially for the first time. Um, the trip itself was almost didn't happen, right? I had called on to community. I was like, wow, this amazing opportunity that I have, and I don't know if I'm going to be able to make it. So, in a nutshell, I said, well, what would I do for anybody that I'm serving? And I called on to community. I created a flyer. I sent it out to everybody and anybody in my network. They continued to send it out. Usually that's how this goes. And the community supported me to get to Washington along with the wonderful assistance of the organization of NACHW. I am uh, as I was going in there through representatives that were there that I have seen in my own state, but to have that one-on-one time with them, along with my other colleagues, Juanette there, it was more attentive. It was definitely attentive to hear us out, to be able to have those wonderful speaking points and assistance of NACHW made a world of a difference. It definitely boosted my confidence and my ability. Being there and being present and having the reaction and the listening ears of our representatives was definitely remarkable. That is what empowered me to continue on. What you see in the second picture there is me coming back to Rhode Island, empowered and equipped, especially with all the tools that I had from going to my trip at the Capitol and being able to support my fellow community health workers here in Rhode Island and be able to work on our current bill over here, our act, and be a voice and be a representation, because the truth is there wasn't a lot of us there representing in Rhode Island. There's usually folks speaking for us. And it's very valuable that we're being heard as the community health workers, as the workforce, and being present. And that's currently one of the things that I enforce community health workers that work with organizations and their leaders within their organizations to empower them to be present for these circumstances, which creates the leadership, creates the better workforce as a whole. And we're heading Spears. We're that much more forward in that aspect. And I'd like to share real quick about what happens after the trip. After the trip was definitely the most vital piece, because being part of and continuing on, I was trying to figure out ways. There wasn't ways that were already scripted on like, hey, besides the link and passing it on to who or other CHWs, I got a little bit more creative, and hopefully this helps someone or more than one on this call, is that I got a hold of a local paper that did a story on me a few years ago on the right to vote. And I realized that that relationship was pretty organic. So I did a quick op-ed and I sent it out to them. It's called Upriser Rhode Island. And I sent it in to them about my trip to the Capitol, because I wanted to respond back to the community that helped send me out there and let them know how it went and, how to continue on this work. And Uprise, with no edits whatsoever, besides switching my name from the top and the information to the bottom, put it out there. So that's another form, and being able to put the word out there and having people know where and how they can have their voice be led in support of us community health workers nationwide. That's my piece.
That is amazing. I know that there's just so many of us so motivated by just that whole description. When we put these events together and we're sitting there with our objectives and thinking of what the outcomes, we sometimes really don't get the opportunity to stop and just really take in the impact and really take in these stories and really understand that we're moving the needle on advocacy, on really, raising the CHW voice, and we're doing that collectively. And I really, really appreciate your your initiative before, right? Getting to the Capitol Hill, putting your flyer together, advocating for yourself, and then really translating that into supporting and advocating for this workforce. I know you sent me the link that I'm going to happily share with folks that want to take a look at that article. I will be dropping it in the chat. But thank you again, Corin. Thank you so much for your leadership, your representation, and I'm really excited to continue to see you grow.
It's an honor to be amongst everyone here on this call, and that many more that are currently in action working and couldn't be with us here today, but always an honor. Thank you so much.
Yeah, I always say things that come out of Rhode Island, it's little, but it's a big impact. So thank you so much for sharing your story. All right, well, we have one more participant that was nice enough to be able to join us today, and now we're going all the way down West Coast to Oregon. I will say that, Team Oregon, man, they brought the energy to the Hill. They were organized, they were ready, they were, they were up for it, as you're gonna see in these beautiful pictures. And I'm really, really excited because Jada, who's gonna be joining us soon, was another person that I connected, just like a couple of weeks prior to the visit, and her dedication, her wanting to be a part of this, and making herself available to the trainings and things of that nature, I know was a lot of sacrifice, and you really shined at the Hill. So Jada, I will pass it to you.
Thank you. So yes, my name is Jada Rojas. I am a community health worker based in Salem, Oregon. This was my first experience, my first interaction with NACHW. I've attended webinars in the past, my first in-person event. So I was super nervous, super excited. I had doubts with even applying for the application, especially given the fact that I knew it was going to be kind of spendy. And within my agency, we don't have a lot of community health workers yet. And so it was something that I just kind of had doubts about if I should ask about this trip or not. And I'm very fortunate that I have a very supportive supervisor and director who's all on boards for trainings and enhancing your skills. And so going to this, I was super nervous, especially my age has definitely gotten in the way as a barrier in my career. And so that also had me nervous, my age, my experience, all of the above. But going and meeting the other people from Oregon was such a great experience. Being able to still be in communication with them, still do this work with them, and really hear about the different things that are happening across is really great. Yeah, so during this experience, this was my first time attending and going out to DC. Having the opportunity to speak to the reps and senators was great. My first experience at a national level like that. It was also great that with speaking with Representative Salinas, that is in the bottom picture, we were able to kind of go off of the fact that she was familiar with the organization that I work for. And her being familiar with the sites and the people we serve was really great, and to be able to build off of that, which helped build the relationship for futures with her coming on site to our housing programs, and still being able to connect on that and hopefully build a relationship for next year. In the continued advocacy efforts, we continue to still email with each other, which has been great. We recently teamed up for the we're just following up with the staffers and thanking them for their time. We did get Senator Wyden to recently sign on the Dear Colleague letter for the funding for community health workers, which is super exciting. And then within my agency, I work for Mid-Willamette Valley Community Action Agency. We are a nonprofit community-based organization, specifically serving those that are houseless, low-income families and independents. So a lot of high-risk needs. And so with that work, coming back from DC, I've been able to advocate the importance of CHWs, expanding training opportunities for CHWs, and prioritizing CHWs in the hiring process. I've also been able to secure a spot on the FEMA board for our area, which is super exciting to be able to help out with that. So that's kind of what's going on right now.
That is amazing. Wow. Listen, we're doing big things. We are doing big, big things. Jada, I just want to say your commitment, your ability to really seek out these opportunities and lean in, even when you're not too sure, it really speaks to just the amazing qualities you have of CHW. And I'm really looking forward to seeing your leadership grow as well, and to seeing your participation in more policy and advocacy. So thank you so much for that. And Team Oregon, go Team Oregon. All right, so before we go ahead into our next national policy update, I know that our fearless leader, Denise Smith, has joined us, and it's always great to hear about a couple of words from Denise. So Denise, I will turn it over to you.
Okay, hey, good afternoon, everyone. Thank you to Catherine Martinez and Angie Kuzma. I know some of the other NACHW team members are on. I love these quarterly policy calls. They started a couple of years ago, and they have served us so well to be able to meet members in their leadership space, right? Discussing policy and advocacy, hearing about their innovations, their partnerships, just sort of marveling, honestly, at all that is happening across the country. But this one is really special because I'm sure I missed one or two presentations, but amazing to just hear from Jada, just to hear from Corin about their time with us in DC, and also what they are leading back home. It really helps the National Association of Community Health Workers build a national movement, right? If we don't hear from local diverse voices from our profession, diverse in geography, diverse in language, diverse in race, ethnicity, across sector and lived experience, we can't build a national movement that is equitable, right? So calls like this are really important. And I see 63 people, including myself, on the call. I just want to thank everybody for stepping out of your day and stepping into this time. Let me give a couple of shout outs. I know there are some board members. I want to just respect the co-chairs of the policy committee, Joanne and Teresa. Perhaps they've introduced themselves, but you can shout them out in the chat. I also want to give a special shout out to Barb Short, who's been my partner for the last several years from Sanofi. We wouldn't be able to do what we did, which was bring 78 individuals. I think I have the number correct, down to Washington, D.C. Without their support. And here's what I want to say. We want to bring more people down. We found that as many people were in the room with us, we had a gap, right? So we have to continuously challenge our movement, our activities, and our strategies to make sure we are including more, not fewer voices, more, not fewer perspectives. And so if you're a partner on this call, partner with us, right? Help to seed this work, this policy and advocacy work, because clearly you see the leadership that is coming forward. And so just really appreciate that. Can I just say one or two things about the state that we are in? This is the post-COVID reality. The last several years, we, NACHW, have been saying, is this a moment or is this a movement? I think now we have called attention to whether or not authentic partnerships are going to be leaning in to the movement of realizing CHW leadership, right? Career advancement, sustainability, broadly defined. And that includes not only our career advancement as individuals in the profession, but for our networks or associations, our alliances, our coalitions across promotoras, aunties, community health representatives, and others. And so we have a lot of work to do in this post-COVID environment. Federal public health investment is a critical tool to increase the awareness of our workforce and of our profession. But currently, many of our CHW networks, associations, and individual CHWs are struggling. They've been losing their jobs since 2022. That is the reality that has been recorded and documented in the news. That's not just from what NACHW has heard. But of course, we heard last year with the formal public health unwinding, how many community health workers were concerned about their own positions, about their organization's ability to keep CHWs on staff. So the movement is about more than just celebrating our excellence, our shine, our grit, our innovation, our get it done-ness. See what I'm saying? It's about investing in who we are and what we do so that we can eradicate the wicked problems that our founders said we were going to come together and eradicate. We do that through our values. We do that through our approaches, in other words, how we show up in the world. And we do that through authentic partnership, right? Allyship with many of you. So I want to thank Catherine and Angie for developing the strategies that realize this vision. Okay. And I want to thank each and every one of you. Some of our founders are on the call, some of our current board members, some folks who've partnered with us in good times and bad. We have a lot of work ahead of us. And these calls are a vehicle, one of many, where we develop and workshop the language, where we align on our vision, our values, and our strategies, and where we move forward together. Finally, I think it's been said, we have a lot of exciting things coming up. We have a virtual annual meeting. And so I want to thank our members for being members. Membership matters. Members help to develop the language and the initiatives. We test a lot of what we are going to do with members in committees and in venues like this. So I want to thank you so much for being a member and trusting us enough, okay, to allow us to grow and develop. We just celebrated 5 years in April, all right? So for some, you might say we're brand new, okay? But we're brand new in a big and exciting way. Okay, we're going for broke. And so thank you to members. If you're not a member, would you consider membership? It starts at $20 for CHWs. If you are a member, we want to see you at the annual meeting because your voice is critical in our governance. You get to vote in new board members. So I need you to do it because I don't do it. I don't vote in board members. So I need y'all to be present and accounted for. I need you to say, who do we want in that governance position? Who do we want as representatives, diverse in all different ways, so that this movement reflects you and it reflects others that you know? And then we have a virtual unity conference coming up. And we are excited for all that that will bring. I'm going to be hosting a special session for network and association leaders, and we have many, many other things planned, awards that will be coming forward, and lots of exciting workshops and training. So Catherine and Angie, thank you again. To my co-chairs of the policy committee, thanks for what you're doing, and thanks everybody for showing up for the movement. Take good care.
Thank you so much, Denise. Thank you for those amazing words. Also, thank you, Aurora, for dropping in the chat the link to the membership and also for the registration for our annual meeting. There'll be a lot of information coming out in the next couple of weeks, and we're really looking forward to seeing all of your representation and participation in the annual meeting. All right, so now we can move over to, I'll continue to share my screen. I will pass it over to my colleague, my partner in crime, Angie Kuzma, and our partner in crime, Ali from PIH, to talk a little bit more about our national CHW policy update.
Hey everybody, if you missed my intro earlier, I'm Angie. I'm a community health worker based in Portland, Oregon. And yeah, I work for the National Association with Catherine and Denise. And so before we get into some national CHW policy updates, I want to give a shout out and a quick introduction to our partnership with Partners in Health US. So Ali will come on and introduce herself momentarily, but Partners in Health US is a nonprofit social justice organization, and that's the US arm. They're a global organization. There's some information about who they are and what they do and what their work is. Next slide, please. And their partnership with NACHW has truly increased our capacity to pull off events like the Hill Day and to be active in the policy and advocacy space in the way that we are. And so I just want to give a big shout out to Partners in Health and just say thank you so much for your partnership, because we wouldn't be doing this, I don't think, without you. So this is just a brief high-level overview of everything that we're doing together in partnership with Partners in Health. And so we'll get more into most of these items in just a moment, but Allie, would you mind coming off mute and introducing yourself?
Hi, everyone. It's an honor to be here and see so many familiar faces and new faces. I'm Allie Bloomgarden. As Angie said, I work at Partners in Health United States. I'm our advocacy engagement manager. You may have seen me or my colleague Lucas Allen around. He is on vacation, so we're happy for him. I'm calling from Brooklyn, New York, or unceded Munsee Lenape land. And should I keep going over what we're working on? Okay.
Yes.
First of all, thank you for inviting us here. And just again, thank you to Corinne, Joanna, Jada. Like I was crying listening to your stories. Just getting to share this space with you all is truly an honor and a privilege, and being part of this. So thank you. Speaking of the Advocacy Day or the Hill Day in DC, and then what's going forward. So as Catherine mentioned, when we were in DC, we were telling legislators all about the CHW Access Act and how they can support this legislation. So we worked over the past year to get this legislation drafted, NACHW, PIH, and getting CHW input on this legislation. And it was, as Catherine mentioned, it was introduced right before the Advocacy Day in March. As you can see, Senator Casey introduces legislation to support CHWs, improve health outcomes. So I just want to give a quick update of where we're at. And also what it does. I feel like in some spaces I'm saying this over and over, so if you've heard this 1,000 times, I'm really sorry. If this is new for you, welcome. But in short, the CHW Access Act would provide access to CHW services for Medicare beneficiaries and encourage states to cover CHW services for Medicaid beneficiaries. And this would have a great impact on coverage of CHW services. And millions of Americans would have access to these services. And as you all know, the benefits of CHW services. And we want legislators, members of Congress, people in DC who represent us, who we voted in, who, if we are eligible to vote, who we are constituents of, regardless of voter status, like you live in their communities, they report to us, we're their bosses, we vote them in. And so we need to tell legislators about what we want and what CHWs and CHWs allies want. And so that's exciting that this legislation got introduced, but what's next? So we told legislators about it in March, and we're continuing to tell legislators about it. You have every opportunity as a CHW and ally to contact your member of Congress and tell them all about CHWs. As an individual, you can do this. You can always educate your members of Congress. If you do this on behalf of your organization, I encourage you to speak with them. I'm not giving you legal advice. But I want to say, we've had a few questions. So like, what is the future of the CHW Access Act? So right now it has been introduced into Congress in the Senate. We are waiting on its introduction in the House. We have been told that that will happen. So we're just waiting for the office to do that. And then we want sponsors and co-sponsors. This is where we want legislators to put their name on it and say, I co-sponsor this legislation. We've gotten questions. So what is the timeline for all of this? Well, we would love to see this bill be passed right away. We also know that oftentimes it is very normal for bills to take a few years to pass for a few Congresses. Congress changes every 2 years. We vote new folks in. So the November election has the impact on local to national offices. And so depending on what the makeup is in Congress, starting in the new Congress in January of 2025, then we will go from there. We will fight to make sure this legislation is reintroduced in the new Congress, and then we will go down the same path. So it's very normal that a bill doesn't get passed right away. Again, we would love for it to get passed before the end of the year, but that's totally okay and not something to be discouraged about. And so why do we keep fighting until December if there's going to be a new Congress? Well, every time you gain a co-sponsor, that's forever. A legislator is putting their name on something that goes on congress.gov, that goes on the books. We want to build relationships with legislators longitudinally and relationships with their staff. So even if a member of Congress changes, they're out of office, they leave office, oftentimes staff stay or staff transfer offices. People work on Capitol Hill for years and years and years. Maybe in the future, they're going to run for office. So you want them to know about CHWs and the amazing work CHWs are doing. So again, very little work gets done in one cycle. That's totally normal. So we need to, the education about CHWs is forever. So, and as I said, if it's not passed before November, we reintroduce. Future passage is very possible, but it always takes time to build champions. And so we're all here to build champions. Angie has put some great tools in the chat. So we had 274 organizations, maybe like those of yourself in your org, to support the CHW Access Act, saying, hey, Congress, we support this, you should too. This is demonstrating our power long-term. This letter exists, we have sent it to Congress, we can always show it. We also have some unbranded social media graphics and tools, which you can, if we go to the next slide, Catherine, you can see a few of them. So you can go into the chat and see the unbranded social media press kit. So you can download these, you can post about them anytime. If you as an individual want to contact your member of Congress to support the CHW Access Act, you can click this link and it will help you send a letter to your legislators. You just put in your address and it helps you figure out who your legislators are. And then we have a draft template email. You can press send or you can edit it as you see fit. If you want to spend more time talking to your legislators and want coaching from NACHW PIH support, we are here. Please email me, Angie, Catherine, Lucas, and we will help you. Okay. Next slide, please. Oh, I already answered this. I spoke too soon. Next slide, please. Okay. Another aspect of sustainable funding for CHWs is money to the CDC. So we have money through the CHW Access Act that if that bill was passed, that would be amazing. Another option is through and we want all the different options, right? We want sustainable financing from multiple different directions for CHWs. So another aspect is the federal budget. This is a budget that happens every year, and this is how money gets spent from Congress. So in March, Congress passed the federal budget for FY 2024, which is the fiscal year we're in, and now we're looking into advocacy for FY 2025. So some programs, as you've maybe heard from some of your colleagues this past year, have received earmarks for their specific programs in the budget, but Congress failed to provide the CDC with funding specifically for CHW grants. Right now, there is a line item in the federal budget that says the CDC should give $50 million to or Congress should give the CDC $50 million for CHW grants. So that line exists, that bucket exists, but it has not been appropriated, meaning those funds haven't actually, the dollars haven't actually been sent out. So we've been advocating for that money to actually be allocated and appropriated. So NACHW, PIHUS, and CHW advocates over the past few months work to get 15 senators to sign a letter calling for funding for CHWs in the next year's federal budget. Again, this thinking longitudinally, this is amazing to say that 15 senators said we support this. We also did this in a matter of 2 weeks. So again, like just thinking of how much can show over time. The federal budget happens every year, so we want to keep this up and keep it growing and moving, and that's really exciting. So those are some policy updates that we've all had the privilege of doing we at PIH have had the privilege of doing in step with NACHW. Okay, next slide. I think that's all from me. Cool. Angie.
Sure, yeah. And if you want to get updates like these more often, please join the National CHW Policy Working Group, which is something, a bi-weekly meeting that NACHW and Partners in Health launched back in February. And it's really to bring CHWs and allies together to keep each other informed of timely federal CHW policy developments and co-learn about different advocacy opportunities. Ultimately, it's to promote CHW leadership and unity and collaboration across all the sectors of this diverse workforce. Next slide. We are going to be recruiting for an advisory committee to help advise and guide the work of this working group. Keeping in mind, it's not a coalition or a group that does direct advocacy, but it's where people who are doing advocacy and are working on policy development come together to keep each other informed of what they're doing. Regardless, this is an important, it's a bi-weekly meeting. It's inevitably, it's kind of part of our landscape in the national CHW community. It needs to be led by community health workers. So we're going to be recruiting an advisory committee of at least 50% self-identified community health workers to support NACHW and PIH as we coordinate these bi-weekly meetings. Stay tuned for more information about that. There will be honorariums for advisory committee participants. Next slide. And yes, you can sign up to get the meeting invitations and other information through the link that I think we're going to put in the chat pretty soon here. And the next meeting is next week, Thursday, June 6th from 1 to 2 Eastern. Hope you can make it. Next slide.
And next slide is me. Thank you, Angie, so much. Thank you, Allie. Just such incredible honor working alongside you guys and your deep dive into all of this that I know it's sometimes so hard to navigate, but it's that education piece of encouraging people to learn about the process, to learn that baby steps are important steps. And thank you for always being a resource to NACHW members and CHWs in the work field. Really appreciate that. So on the heels of that excitement, I wanted to talk a little bit about National CHW Awareness Week. As most of you know, last year was the first year that we launched the campaign, again, coming off of the momentum of unity, that energy we had up in Austin. We had our first Hill Day. We really wanted to continue that momentum going, and we put together the first National CHW Awareness Week campaign that was featured the last week in August. This year will be the same thing. We are going to declare the last week in August 2024, which is August 26th through August 30th as National Awareness Week. There will be a lot more information coming out in terms of how we're going to roll it out with our kickoff, when the toolkit is going to be available. We're going to be working really closely with my colleague Aurora, who's going to help really connect some of our members, networks, and associations to trainings for folks that haven't participated in some of these efforts in the past. And then, we're really looking to make sure that we have the representation that really is aligned with the diversity and the regional diversity that we have as a profession and as a workforce. So that being said, there is going to be a lot of engagement, a lot of outreach, and hopefully a lot of collaboration to make sure that there is a lot of visibility, that we are spreading awareness, that we are educating, that we are meeting with legislators to provide that education. And in the same vein, for folks that want to have more direct ask with their congressional leaders or want to have some more let's say, advocate for certain things, we're going to be providing that support as well. So we're really looking forward to CHW Awareness Week to be very robust. Here in the slide, you're able to see some of the highlights from last year in terms of the participation. And this year, you know, we really want to make sure that we're doubling that. We want to make sure our reach is bigger, and we want to make sure that our diversity it really is a good reflection of our workforce. So there's going to be more to come on that. You guys can expect the same in terms of the toolkit. It's going to provide a roadmap to guide participants through the process and hopefully be thought partners on your strategy for this national event. We're going to be able to provide a checklist. So as you're putting together your events, you're making sure that you're taking the concise steps to make sure that these legislative meetings or meeting with folks from the community are successful. We're going to talk about talking points, right? We're going to talk about how you can have talking points around education and awareness, and how you can have talking points around very specific asks, you know, very similar to what we provided for the participants that joined us at Capitol Hill. And then we're going to have templates. Like, we're really looking to make this as user-friendly, easy for folks to be able just to kind of customize some of these templates to fit your needs, and hopefully that this is a very seamless process. So very exciting. Very looking forward to all of your participation. I am going to be in your inbox in the next couple of weeks, encouraging you to sign up, encouraging you to outreach, and hopefully getting some updates on what are your plans for National Awareness Week. And, you know, and like I said, this year we want to, you know, we're going from the inside out, right? Like, our board is showing up, our founders are showing up, staffers are showing up. We're going to be really seeing our national associations and networks really showing up in their own way. There's going to be like a little competition, like who can show up even like bigger and better. So you don't want to miss out. It's a very exciting time. It's the summer. It's a great way to kind of wrap up all this hard, amazing work that you all have been doing this year. So please participate and join us. And, you know, all of that excitement is going to lead to some real action, right? We're going to need some action items. And one of our key talking points in Washington was really around building the support for declaring a resolution to declare the last week in August 2024 as National Awareness Week. So I'm going to invite Allie back on just to talk a little bit about that process for the resolution, and maybe highlight how we plan to. We do have to request this every year. So Allie can talk a little bit about what that process looks like.
Hello again. It's me. Thank you, Catherine. So the National CHW Awareness Week 2024 resolution. So as Catherine said, this is something that happens and needs to happen every year. So you get a resolution introduced in Congress that says Congress supports the designation of the week of this year. The dates are, Catherine, I already forgot.
It's August 26th through August 30th, the last week.
It with us. August 26th, August 30th, designating this week as National CHW Awareness Week. So that's really exciting. This happens in states and nationally for all different issues where Congress says we declare this week. So we got this last year in Congress, and we are asking for it to be reintroduced. So our allies and CHW supporters in the House and the Senate will hopefully reintroduce this resolution with the updated dates. You can see a clip on the screen is from last year's legislation or resolution, and we're working on it, and hopefully we'll get it reintroduced in July. And you can also, we'll create like a similar toolkit that we put in the chat above for you all to be able to easily contact your members to say, please co-sponsor this resolution, and, you know, claim your support, show your support publicly for CHWs, and declaring this week National CHW Awareness Week.
Yeah. Thank you, Ali. And I will say we had a lot of good reactions for folks that were meeting with their legislator in March, where we brought this up and asked them to be able to support it. And it was like, for so many of them, a no-brainer, like, yeah, I would love to. So now it's really about that follow-up, reconnect and remember what you said in March. But it really comes down to them just being visible. CHWs being visible and understanding and driving the message that it's important to really support the workforce and the profession. So all of this ties in together. The resolution is really like the cherry on top for CHW Awareness Week. But I would definitely say the meat and potatoes is making sure that we show up, that we put together these events, and that we are rocking out the last week in August for CHW. So thank you so much. And like I said, there will be more information to come in the next couple of weeks. All right, so it looks like we are reaching the end of our presentation, so I will stop sharing my screen now and wanted to give the opportunity to really open it up for folks. I know we've been talking at you all this time, and I'm sure there might be some questions or maybe some comments that are coming up for some folks. Let's take advantage that we have our wonderful co-chairs here from our policy committee. I think Denise is still around. Angie and I and Ali are always happy to answer questions as well. You can either drop it in the chat or you can go ahead and just raise your hand and jump right in. But again, thank you so much all for participating, by joining us, for your engagement, and just really looking forward to continue to move this policy and advocacy work forward that is so critical to this workforce. So any questions, comments? Betsy.
Thank you. What an excellent presentation. I'm really happy to see all of this engagement. One thing that I want to report back is the fact that I was able to be an invited speaker for the Georgia exposition on November the 21st and November the 22nd. It was a great group, virtually speaking and in person as well. I had a good section with good engagement. We talk about fundamental things around the proliferation of names in the CHW workforce and how that impact funding and sustainability. We talk about training. There were many presenters talking about training. And this is something that I would like to bring to the board members, and hopefully Denise is here. Denise, I have an email almost done to send to you, because one of the questions that was raised during the table discussion was the whole thing about training in terms of who should be training community health workers. I mean, nurses train nurses, physicians train physicians, but it seems that everybody feels the need to train community health workers. So at any rate, I raised the idea of how we can work with those platforms that are already in place, where they had trainings for community health workers, and then inviting those states that have a certification process in place, and maybe convening a meeting when we can start talking about how training for the national perspective will look like for community health workers, and who should be leading those efforts. Of course, you all, but that's the question that we have to raise, and then come up with some grounding rules when it comes to community health workers. There is a lot of say that there is a lack of standardization when it comes to training. Standardization might be a word that scare many, and some others will be in favor. Well, those are the hot topics that had to be discussed at the table. And I'm willing to help convene this kind of communication between the interested parties, especially those that are developing training for you all. And to ensure that the voice of community health workers is at the table right at the beginning and not an aftertaste. So that's one of the takeaway messages that I got from that meeting. And then to report that finally, as of today, the CDC training work group, part of the CDC CHW work group, has agreed on conduct the CHW awareness event. This is year number 4. that we're doing this. And this is an internal CDC activity. And it's going to be conducted on the 29th at 1 p.m. I have asked to our work group members to send us some potential speakers. There is a particular community health worker that we have been looking to her videos, and I don't recall her name, but I will share with you all later on that we're thinking that she could be a good keynote speaker. I have been looking to her videos. I will share with Angie, Ali, and you all the videos of the lady that I'm talking about. I listened to her in another conference, and I was fascinated by her passion, by how well she was articulated, and she is a community health worker. So I would like our event to be open by a community health workers. The main purpose of the event is to increase awareness about the vital role that community health workers play in many settings, to the CDC staff, organization-wide speaking. And that's it.
Thank you so much, Betsy. Thank you, thank you. Thank you
And
for
we
always
know
for your
where-
leadership and just always being willing to share all of this amazing opportunities and information. Thank you so much.
Ms. Martinez,
Yeah.
or Ms. Rodriguez, can we know where you saw that one speaker, Ms. Betsy? That one community health worker that you were just talking about? Where
Yeah, the CDC CHW work group was an unofficial CDC CHW group that was initiated in my center, in the chronic center. And then through the pass of the years, many other departments and CAOs and division has been engaging in the group. So now we have two different categories. We have active members, those that are engaged in our committees, doing the real work, you know, getting wet into the work. And those that are lipserv members, those that may have some interest, may have worked in the past with community health workers programs and initiatives, and they still want to be connected and be informed. So we develop a monthly update to keep everybody abreast of the things that are happening. And then within the work group, we have two committees, the training committee, the technical assistant committee, and the communications committee. I used to be one of the founders of this group. Well, I was one of the founders of the group, used to be the chair. Now I am the lead person for the training and technical assistant, along with Dr. Hope Thompson for the training one. And the CHW Awareness event was an idea that we developed 4 years ago. And it has that main purpose of increasing awareness about CHW, and as a way to educating our coworkers about who CHWs are, what are they do, what are their core competencies. I mean, all of those things. And the whole envisioning aspect that we were having here is to get our CDC staff well-informed, well-educated. So when it comes to grant writing and many other opportunities, we want to ensure that we have a workforce with the competencies that are required to engage effectively community health workers. As of 2 months now, we are an official CDC CHW work group. After many years being on an official one, we are official CDC work group right now. And this event is one of the many activities that we conduct here. The reason that is internally, it's federal regulations. You know, we have to deal with so many things, and whatever we have to do, we have to be clear. There are so many processes, internally speaking, that we have decided to keep the event as an internal event. However, Denise has been our speaker the last 2 years, actually 3. The last 3 years, she has been the opening remarks speaker in our event, and we have been working hand by hand with NACHW in putting together this event.
Thank you. Thank you so much, Betsy. Incredible, incredible strides. Andrea, do you have your hand up? I believe so. Or was that?
I apologize, no.
No, no worries. Just wanted to See if you had another comment. Anybody else? And don't be shy if this is your first time joining. If you have, clarifying questions, this is definitely the opportunity to do so.
When the toolkit is going to be available, Catherine?
Sorry, what was that, Betsy? Oh, you're on.
When the toolkit is going to be available?
Yeah, so the kickoff is going to happen the last week in June. So before July 4th, the toolkit will be available for folks.
Can you anticipate it to me if there's anything related with sustainability funding for community health workers?
Yeah, there's that. I did make that note from the last time that I'm going to check in with you on. We're splitting up some of our talking points to make sure that some participants who don't have the ability to participate to engage in any kind of direct lobbying and direct ask also have talking points as well. So we're designing that at the moment, and I'm more than happy to share with you and the whole policy committee as well.
That would be great because, I mean, today I was able to work with my committee and we have the description of the event and we have the goals and we have the objective based on an assessment that we did internally in terms of what the topic is about. And the topic is again, even on sustainability, but financing, but with the emphasis on, we really want to talk about payment models. What seems to be working? Where are they? Who's doing what? Kind of conversations. So we're gonna be, getting wet into those conversations, and we're looking for speakers. If you have any recommendation for speakers, that will be so welcome. Oh my God, yes. And by when do I need yes? That, of course, yesterday. I need that information yesterday.
Yes, all of this information, I totally hear you on that. That's how I feel about the toolkit. I need everything done yesterday, but it's going to come along. I know that possibly Angie and I would be happy to talk to you offline and maybe connect on how to circulate that ask for you.
I see Omar saying that he
Yeah,
wants
Mars
to be
in the
speaker.
chat saying he is
Well,
raising his hand.
BJR6@cdc.gov, send me your bio and send me your expertise, and I will submit your name to the planning committee.
Yeah, Betsy, if you can drop your email in the chat, that would be great. I think folks.
I'll do that now.
Connect.
Catherine, we need a toolkit as soon as possible, and maybe consider for next year that maybe that's something that we can start working ahead of time.
Yeah.
Just here in Portland, we are working locally with the cities, and everybody's on board, but we are waiting on the toolkit, and there is a lot of momentum to really bring, and they really were asking for that. So maybe we consider, because the people say, well, as a CHW, we had to plan, because we had all the cases that we had to attend and all the activities. So we had to do the planning ahead of time. So this will be so essential to do as soon as possible, because we are holding all the momentum.
No, thank you for that feedback. I think absolutely we want to meet the moment and we want to make sure folks have what they need in a timely manner. So absolutely noted. And we're definitely going to push that up to get it out as soon as possible.
Catherine, I also want to report that I have been invited by the ADA to be part of the CHW work group. I had been part of that group for a long time, but now they're working on recreating, again, education for community health workers, this time on diabetes. And they have suggested several modules that we're going to be working on. And I had the opportunity in the past to do a presentation with Wendy Hernandez.
Yeah.
And so we made sure that the presentation that we did as a team was grounded in the C3 project competency. So we did kind of a case study type of presentation. And I suggested to ADA to look to that model that Wendy and I developed by putting that presentation together. Because when I saw the first draft, I said, well, you take the name of community health workers out of this, and this is an outline that could apply to anyone. So it has to be specific to community health workers, and this is why you don't need me. You need community health workers to be part of this planning so they can have a voice here. But at any rate, I'm part of the meeting. I know that Durrell is part of that group as well. And so we're looking to identify speakers that wanted to do this. So if you have the diabetes knowledge in either people with diabetes or people with pre-diabetes and would like to be a part of the faculty, my email is there. Send me that information so I can push your name forward, because this is the time where the name has been requested to our group.
Thank you. Thank you so much, Betsy. And we've had a couple of comments in the chat, so if folks scroll up, I think you'll be able to get her email.
Yeah. Hey, Catherine. I want to just kind of revisit something that came up earlier, and Betsy, one of your comments, and thank you so much for, contributing to this conversation. The question of who should be training community health workers, and all of a sudden everyone wants to train CHWs. One of the things that NACHW prioritizes in our advocacy efforts is to really uplift the capacity of local, state, and regional CHW networks and associations. So the Oregon Community Health Workers Associations, the Michigan Alliance of CHW, those state and local organizations that are supporting the workforce at that level, really see those as the local experts. And that's one thing that really excites me about the CHW Access Act, actually, is there's actually language in there that encourages states to partner with their CHW networks. So I believe CHWs should be training CHWs like you brought up. And yep, the Louisiana, there's too many to name right now. Just kind of giving a few examples, but yes, we want to see those as the go-to providers for any technical assistance needs, local experts. I just wanted to voice that over. And
well, Angie, I am writing a concept paper that I would like to share with you first, so I can get your input of this idea that came out of that Georgia exposition, and with the network that I was able to do there, and people that are doing training. So they're willing to meet with us and find solutions to the problems around training and continuing education for those that require certification process in place, and how we can include those that certify community health workers to be part of the conversation. I think that a national type of meeting needs to happen in this area sooner than later. And so I'm writing a concept paper that I will share with you and see how we can take it from there.
Great, looking forward to that.
Hi, I actually would like to share something. My name is Andrea Rincones. I'm from Houston, Texas. I work with Baylor College of Medicine. I'm their research administration specialist, but every time I do any trainings, I say, let's do away with all that. At the end of the day, I'm a community health worker instructor. That's what I'm always going to be naturally. So one thing that we actually did this summer that was very different, opposed to other education I've seen for CHWs out there, what we actually did this year was that we took a resume class that DFPS gave us CEUs for, but I took a very different approach to it, that being CHWs with lived experiences. So for instance, the fact that I call them superpowers, like for instance, being able to walk into a room and be able to read it so well that you know what to do, those type of special skill set. So although, how do you place that into a resume? So a lot of the things that I actually saw for CHWs here in Houston and in Texas is that what we've been trying to do is take the education and kind of put a CHW twist to it. For instance, that resume building one. The resume building one, I took a different approach saying, what is your special skill set? What makes you become a CHW? What makes you stand out from the other workforce? And I have to say, I've been a big advocate about the 6 pillars that came out. I've been actually doing classes galore for it. I've been waiting for those to come out so bad. So anyways, so that was one way that we actually took that approach. And that also being with self-care. Never in my self-care presentation for my CHWs, I will never mention reading a book or doing yoga. I try to keep it really real, and I try to go back to where I come from, under the federal poverty level, keeping it hood and working with what I got to get where I want type of concept. And what we actually saw in our annual CHW conference, the attendance was so high because of the series that we had prior to that, and our mission of just kind of honing down our education truly to the CHW work, honing down to, guess what, we have lived experiences. A lot of us have lived experiences, hence the reason that we are a unique workforce. So your pillars go absolutely perfection with the presentation that I've made. So I just wanted to share that because what I've actually seen is that some CHWs are I'm starting to see their light kind of diminish a little bit, because we're starting to see people with doctorates going back to school and getting their CHW certificate, which there's absolutely nothing wrong with that. But some of the CHWs that have only lived experiences, and that's how they've been able to make a career and a platform plus a massive name in the state of Texas for themselves, they kind of see this as, oh my God, what's going on with the CHW world? This isn't supposed to happen. So I really wanted to share that with y'all and see what kind of feedback y'all have on that.
Thank you so much.
Of course.
We have a couple of folks with their hands up, but just wanted to give an opportunity if anybody had a feedback, or Andrea, if you can also drop your email in the chat just in case folks want to follow up offline.
Most definitely. I will.
All right, Ashley, I see you with your hand up.
Hi, everybody. Nice to see so many friends today. Ashley Winterstrom, LSU Health in New Orleans. Just wanted to make a quick comment, which is just to remind folks as we're thinking about issues related to training and developing training and standards and things like that. I'll put this in the chat, but just wanted to remind folks who are familiar with this, and for folks who may not have known about this already, just that there is an American Public Health Association policy on this issue of who should be developing standards for training community health workers or anything really governing the workforce. The link to the policy is right here, but it basically says that any entity determining training or workforce standards for CHW should be at least, an emphasis on at least, half CHWs, because we want CHWs to really be the leaders and the voices for leading their own profession. So I wanted to put that in there, and just note that NACHW also endorses that policy. And also I came on really late, so please forgive me if this was already discussed.
No, thank you, Ashley. Thank you so much. Omar.
Yeah, in our organization, we are preparing. I already prepared to be as a trainer for CHWs, and we develop a training session for CHWs as well. But we are open to accept more people that is not certified yet and willing to, have some grants for that and at no payment. And that's how we do that in our organization. So everybody's welcome to apply. And we have in July starting a new curriculum for CHWs, and we're ready to help.
That's awesome. Thank you so much, Omar. Monique, I think you had your hand up. Not sure if you did or not, but if you had a comment, go ahead.
Yes, I actually was going to ask for Andrea's information, and I saw that in the chat, so that is perfect. But just would love to reach out and speak with you, Andrea, about what you just spoke about, because I just did a community of practice with CHWs, and the topic was lived experience. And how do you put it on a resume? How do you put it on an application? How do you talk about it? Are you seeing pros or cons? Because sometimes, say if you are a felon or you are in prison, now some people might look at that as a bad thing as lived experience. And so how are we discussing these things? And also, promotion ladders, it usually, or just even being hired, you have associates, masters, bachelors, doctors, all this, and that's how you know what level you come in. But if you're a CHW, how do you do that? What's the standard? Is it years? Is it where you worked? How are we, getting this idea? And everywhere you go and work is going to be different depending on, their idea of what your, lived experience is worth. And so
Exactly.
now we're allowing someone else to tell you what your lived experience is worth at that time. And so I would love to talk to you and see how we could do that so I can, bring that to that community of practice. So thank
Most
you.
definitely. I am on a mission. I've been on this mission for the last 2 years, ever since I saw that fear in their eyes whenever this topic came up, and they were like, oh my God, am I gonna not stand out anymore? Or, is my experience, my lived. And we're talking about heavy hitters. We're not just talking about, we're talking about CHWs that have made a platform of their trauma and have taken it, owned it, threw it back out to educate. So absolutely, most definitely, Ms. Monique.
Thank you.
I
Omar.
want
Go
to
ahead.
comment in that we have a speaker in one of the trainers training sessions, and she was coming from Arizona from incarceration, and she made a good life after that. I mean, she's awesome. And we took it as a good example how people can become from their dramas and their things going on day to day, and they go through, they are successful.
Thank you. All right, well, I see we have 1 minute left, so we have a lot of good comments and context in the chat. This is recorded, so we will be sharing the recording with folks and the slides as well post this meeting, in addition to a quick survey that I would really encourage you all to take. So important for us to collect data and make sure you guys are getting what you need out of these webinars, and also moving forward how we continue to cater to our members. So please be on the lookout for those pieces in your email, and please take the survey. We would really look forward to hearing from you all. Thank you all for your time. Thank you all for your dedication. We really appreciate y'all, and have a great rest of the week.
Thanks, everybody.
You all.
Bye.